Hi, let's see an NCLEX RN video based on care of patients with multi-drug resistant organism infectious disorders. Multi-drug resistant MDR organisms are common causes of nosocomial infections. Methicillin resistant Staphylococcus aureus MRSA, vancomycin resistant enterococci VRE, Clostridioides difficile, C. difficile, Acinetobacter baumannii, and Carbapenem resistant Enterobacteriaceae are all examples of MDR organisms that causes nosocomial infections. Let's see the first question. The nurse monitors for which clinical manifestation in the patient diagnosed with Acinetobacter baumannii, that is A. baumannii. The options are toxic megacolon, wound infections, pneumonia, and peritonitis. So here you need to know the most frequent clinical manifestation of Acinetobacter baumannii infections are ventilator associated pneumonia and bloodstream infections. So here pneumonia is the answer. Toxic megacolon and peritonitis are complications of Clostridioides difficile, C. difficile, and this MRSA will show wound infections. Second question. The charge nurse is making assignments for the next shift. In looking at patient combinations, the nurse recognizes that a patient with an MRSA wound infection can be located in the same room with what other patient? The options are a patient who has an Acinetobacter wound infection, a patient who has C. difficile, a patient who has an MRSA wound infection and has VRE. VRE is vancomycin resistant enterococci. A patient with MRSA bacteremia. So here the patients colonized or infected with multi-drug resistant organisms are placed in private rooms when available or placed in a room with other patient colonized or infected with the same organism. So the patient with different multi-drug resistant infections are not cohorted together. So here the patient is having MRSA wound infection. So here we have to locate the patient with another patient with the same MDR, that is MRSA bacteremia. A nursing preceptor is observing a newly hired nurse caring for a patient with C. difficile. What actions indicate correct isolation technique by the new nurse? Select all that apply. Discarding the isolation gown prior to leaving the room. Discarding the isolation gown in a trash can by the sink outside the room. Washing hands with soap and water immediately before exiting the room. Washing hands with alcohol-based cleanser immediately before exiting the room, or wearing the gown tied at the neck and waist. Isolation precautions must be used for patients with MRSA, VRE, Clostridium difficile and Acinetobacter. Hand hygiene must be performed before the healthcare workers put on the isolation gowns and gloves. Isolation gowns must be tied at the neck and the waist to effectively prevent bacteria transmission. Isolation gowns and gloves must be removed before the healthcare worker leaves the isolation patient's room. Hand hygiene must be performed before leaving the patient's room, and hand hygiene of Clostridium difficile requires the use of soap and water. Note alcohol-based sanitizers, to physically remove the spores. So here the patient is having the Clostridial difficile infection. The nurse should discard the isolation gown prior to leaving the room, and also washing hands with soap and water immediately before exiting the room should be done, and the gown should be worn tied at the neck and waist. So this is the answer. The nurse understands which MDR organism is seen in healthy patients living in the community. Is it MRSA, VRE, C. difficile, Acinetobacter? Out of these, methicillin-resistant Staphylococcus aureus is the only MDR organism that is readily seen in community as well as in healthcare setting. The nurse monitors for which complication in the patient diagnosed with Clostridioides difficile. Select all that apply. Increased BUN and creatinine, abnormal electrolytes, hypoalbuminemia, pneumonia, extensive wound infection. So here you need to know about the complications of C. difficile infection. So severe C. difficile infection leads to, one is volume depletion or hypovolemia and hypotension, low blood pressure you can see, renal insufficiency, electrolyte imbalances you can notice, especially hypokalemia, hyperkalemia, hyponatremia and hypernatremia can be seen. Hypoalbuminemia, that is low serum albumin level, you will notice. Peritonitis, that is the inflammation of the peritoneum. Paralytic ileus, that is the intestinal obstruction you can notice. Toxic megacolon, that is the rapid dilation of large intestine can be noticed. Fulminant pseudomembranous colitis you can observe. Sepsis and death. So these are the main complications. So of course increased BUN and creatinine because renal insufficiency we told. Then abnormal electrolytes with sodium and potassium we told. Then hypoalbuminemia we told, that is low serum albumin level. But this pneumonia and wound infection, they are not associated with the complications of C. difficile. Which are the risk factors for MRSA infection? Select all that apply. Surgery, urinary catheters, antibiotic use, feeding tubes, recent hospitalization. So the risk of hospital-acquired methicillin-resistant Staphylococcus aureus are current or recent hospitalization, residing in long-term care facility, invasive procedures or medical devices, recent antibiotic use, weakened immune system, comorbid conditions, dialysis devices, and gastrointestinal disorders. If you see community acquired MRSA infection, the risk factors are less than 2 years of age, athletes, IV drug abusers, men who have sex with men, military personnel, prison inmates, people living in shelters. So here the risk factors are surgery, urinary catheters, that is invasive devices, medical devices, antibiotic use, and recent hospitalization. Feeding tubes that are not a risk factor for MRSA infection. The nurse is screening patients for the risk of developing VRE. The nurse should consider which patient at greatest risk. VRE is vancomycin resistant enterococci. The risk factors for VRE are very similar to MRSA. They include prolonged hospitalization, weakened immune system, prolonged antibiotic exposure, invasive procedures or medical devices, and comorbid conditions. So here the patient is cared for at home. So that is not a risk. The patient with prolonged antibiotic exposure, of course, The patient in a small community hospital setting? No. The patient hospitalized for an uncomplicated procedure? No. The nurse is reviewing orders for a newly admitted patient with C. difficile. The nurse will follow up with the provider about which order. Per oral flagyl, probiotics, encourage fluid intake, and Imodium. Here, the use of antiperistaltic agent, that is Imodium, should be avoided because they may delay the clearance of toxins from the colon and exacerbate the toxin-induced colonic injury or precipitate the ileus and the toxic megacolon that will later result in septic shock. So Imodium should be questioned. Flagyl is the treatment of choice. Probiotics preserve the normal gut flora. Fluids are necessary to avoid potential dehydration due to diarrhea. And for this patient with Clostridioides difficile, we give antibiotics like vancomycin, metronidazole, and fidaxomicin. So the answer is Imodium. The nurse is screening patients for the risk of developing Acinetobacter infections. The nurse should consider which patients at the greatest risk. Select all that apply. The patient on mechanical ventilation, the patient with a high acuity illness, the patient recovering in the ICU overnight after surgery, the patient with prolonged antibiotic exposure, the patient with a wound infection. So the risk factors for multi-drug resistant Acinetobacter baumannii infections and colonization include recent surgery, central venous catheters, tracheostomy, mechanical ventilator, enteral feeding, exposure to antimicrobial agents, and the underlying severity of illness. Other risk factors include prolonged hospitalization, ICU admissions, prior hospitalization, and nursing home residence. So here the answer is the patient on mechanical ventilation, the patient with a high acuity illness, the patient with prolonged antibiotic exposure. What is the priority intervention to prevent the spread of MDR organisms? Hand washing, diagnostic cultures, isolation precautions, and antibiotic administration. The best treatment of multi-drug resistant organism begin with prevention. So hand hygiene should be done. The declining rates of some MDR infection have been attributed to the use of alcohol-based hand rubs and improved hand hygiene programs. John is a 76-year-old male who presents to his healthcare provider from his nursing home residence with a painful red swollen abdominal surgical wound that is warm to touch and is draining pus. He had a cholecystectomy last week and is returning to his healthcare provider to get the staples removed. John has just finished his antibiotics. He takes metformin for his diabetes mellitus type 2 and is on Coumadin for atrial fibrillation. His abdominal wound is cultured and has a MRSA infection. His vital signs are BP 110/66, heart rate 110, atrial fibrillation noted on ECG, respiratory rate 18, temperature is 100.5 degree Fahrenheit. Beside blood glucose monitoring, that is 140, he is admitted to the hospital for a course of IV vancomycin to be given every 12 hours. His abdominal sutures are removed, the wound is irrigated, a sterile dressing is applied, the wound is left unsutured to facilitate drainage and allow for wound care. So here the patient had underwent a surgery and now he has got MRSA infection for the wound and the patient is on treatment with IV vancomycin. The nurse understands Mr. John is at increased risk for an MRSA infection because of which factors? Select all that apply. His recent hospitalization, his history of atrial fibrillation, his recent surgical procedure, his residence in a long-term care facility, his current use of medication Coumadin. So of course his recent hospitalization, his recent surgical procedure and his residence in long-term care facility made him increase risk for MRSA infection. The nurse monitors for which clinical manifestation of MRSA in Mr. John's wound infection? Hyperglycemia, tachycardia, tachypnea, red edematous draining wound. MRSA causes more serious infections of the skin and soft tissue, resulting in red edematous draining wounds. These are all signs of infection. Hyperglycemia, tachycardia, tachypnea, they are systemic. They are not local signs of infection. The nurse should intervene immediately if Mr. John is noted to have which of the following symptoms? Depression, oliguria, decreased appetite, pain at the incision site. Vancomycin can cause nephrotoxicity, which is evidenced by decreased urine output and increased blood urea nitrogen and creatinine. Pain at the incision site is not expected as long as it does not increase significantly. Depression and decreased appetite should be evaluated as they may be signs of patient distress, but it is not a priority. Which statement by Mr. John indicates the need for further teaching? I need to be careful about the antibiotics I take. I will stop taking my antibiotics when I am feeling better. I never want to go to the hospital again. I will call my doctor if my blood sugar goes up. It's essential that patients completely finish their antibiotics as prescribed to avoid recurrence and potential development of antibiotic resistance. Important transitional care plans for Mr. John include which of the following? Select all that apply. Follow up with the home care nurse, follow up with the physical therapist, follow up with the healthcare provider, follow up with the emergency department, follow up with the nutritionist. So here the question is asking the transitional care plan. So the goal of transitional care is to have the patient safely transition out of the hospital. Timely follow-up with care providers is essential. So there should be a follow-up with the home care nurse. There is no need of a follow-up with a physical therapist or a nutritionist, because if it is required, only that follow-up is real. Here we need to follow up with the healthcare provider also. There is no need to go to the emergency department as a follow-up in transitional care. Hope you understood this video. Thank you so much for watching. Please do subscribe.